If you are over 60 and think sugar is the only thing raising your blood sugar, stop for a moment and listen carefully. I hear this misconception almost every day in my clinic. Doctor, I've cut out desserts. I've stopped drinking soda. Why is my blood sugar still climbing? Just recently, a 68-year-old patient named Barbara asked me the same thing. She had eliminated all obvious sweets from her diet. No candy, no pastries, no sugary drinks. What shocked her was this. Her fasting blood sugar had jumped from 98 to 126 in just 8 months. She was now pre-diabetic. She was not eating poorly. She was missing the hidden poison that sabotages blood sugar in ways most people never suspect. New research shows that one very common dietary mistake, especially in adults over 60, can spike blood sugar more aggressively than table sugar itself and dramatically accelerate the path to type 2 diabetes. I'm Dr. Maria Hernandez, and in this video, I will expose that hidden poison, why it is so dangerous for seniors, and the 5 proven strategies to eliminate it from your diet so you can protect yourself from diabetes before it is too late. Before we dive in, drop a comment with your age and where you are watching from today. Have you been struggling with rising blood sugar despite cutting out sweets? Write your answer below because your experience helps our entire community. And hit that subscribe button because I share life-saving health strategies like this every week to help you thrive after 60. Most people believe that as long as they avoid obvious sugars, their blood sugar will stay stable. But in adults over 60, that assumption is dangerously wrong. There is a hidden poison in the modern diet that raises blood sugar faster and more persistently than candy ever could. This poison is invisible. It hides in foods people consider healthy. Without knowing what it is, your blood sugar climbs silently. That is why cutting out desserts often is not enough. Here's the problem. As we age, our bodies become more sensitive to this particular poison. Our insulin response weakens. Our cells become resistant. Our metabolism slows down. By the age of 60, more than 1 in 3 adults has prediabetes. Many do not even know it. Our bodies have accumulated decades of exposure to processed foods, inflammatory oils, and blood sugar spikes. Each exposure damages our insulin-producing cells. Each exposure increases the chance of developing full diabetes. I saw this clearly with one of my patients named Robert, age 71. He prided himself on eating clean. He avoided sweets religiously. He ate whole grain bread, low-fat yogurt, fruit smoothies for breakfast. He thought he was doing everything right. His doctor told him his A1C was 6.2, pre-diabetic range. He was confused and frustrated. When we analyzed his diet in detail, the problem became obvious. Robert was consuming the hidden poison at almost every meal. He just did not recognize it. What most people do not realize is that this poison does not taste sweet. It does not look like sugar. It does not trigger your brain's sugar alarm. It raises blood sugar quietly, persistently, and often more dramatically than pure glucose. In older adults, consuming this poison throughout the day means blood sugar never gets a chance to normalize. Insulin stays elevated. Cells become resistant. The pancreas becomes exhausted. This is why so many seniors develop diabetes even when they think they are eating healthy. Now, here is where the first major mistake happens. Most seniors focus entirely on eliminating sugar while ignoring this far more dangerous poison. They read labels looking for grams of sugar, they avoid desserts and candy, but they consume massive amounts of this hidden poison every single day. The poison I am talking about is highly processed seed oils and ultra-processed carbohydrates that have been stripped of fiber and nutrients. These are not just empty calories. They are metabolic poisons that destroy your blood sugar control. With age, your body's ability to handle these foods deteriorates dramatically. Your liver becomes fatty. Your muscle cells become insulin resistant. Your pancreas struggles to produce enough insulin. Without eliminating this poison, blood sugar control becomes nearly impossible. This is not rare. It is extremely common. That 68-year-old patient I mentioned earlier, Barbara, was eating oatmeal with raisins every morning, whole wheat pasta for lunch, rice cakes as snacks, and multigrain bread with dinner. Every single one of these foods was spiking her blood sugar to dangerous levels. When we replaced these processed carbohydrates with whole foods and eliminated inflammatory seed oils, Her fasting blood sugar dropped from 126 to 94 in just 4 months. This is why understanding what actually raises blood sugar matters just as much as avoiding obvious sweets. If you are finding this helpful, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. Now let us talk about the first proven strategy to eliminate this poison, and this one is extremely powerful. Strategy number 1 is identifying and removing ultra-processed carbohydrates from your diet. If you look at most people's approach to blood sugar control, they eliminate sugar but continue eating refined grains and processed starches. They assume whole wheat bread is healthy. They think rice cakes are a good snack. They believe low-fat crackers are safe, but these foods break down into glucose faster than table sugar. Ultra-processed carbohydrates have had their fiber stripped away. They have been ground into fine powders. They have been processed until they are barely recognizable as food. That processing changes everything. When you eat an intact grain, your body has to work to break it down. The fiber slows digestion. The nutrients support metabolism. Blood sugar rises gradually and moderately. When you eat that same grain processed into flour, it hits your bloodstream like a sugar bomb. There is no fiber to slow it down. There are no intact nutrients to support healthy metabolism. Blood sugar spikes rapidly and aggressively. In adults over 60, this matters even more. Your digestive system has slowed down. Your insulin response has weakened. Your cells are more resistant. Ultra-processed carbs create blood sugar spikes your aging metabolism simply cannot handle. I saw this with a patient named Catherine, aged 66. She was eating what she called a healthy breakfast every morning: low-fat granola with skim milk, a banana, whole wheat toast with jam. She measured her blood sugar 2 hours after breakfast. It was 178. She was shocked. That meal contained almost no added sugar, but it was entirely ultra-processed carbohydrates. We made one simple change. We replaced that breakfast with 3 eggs cooked in olive oil, half an avocado, and a handful of berries. Same calories. Vastly different blood sugar response. 2 hours after the new breakfast, her blood sugar was 102. The difference was not the sugar content. The difference was eliminating the ultra-processed carbohydrates. Within 3 months of removing these foods from all her meals, Catherine's A1C dropped from 6.4 to 5.7. She was no longer pre-diabetic. Research shows that ultra-processed carbohydrates raise blood sugar more aggressively than equivalent amounts of pure glucose in many people over 60. White bread has a glycemic index of 75. Pure glucose is 100. But white bread often causes longer-lasting blood sugar elevation because of how it is processed and absorbed. The key lesson here is simple. If you are over 60, assuming whole grain processed foods are safe may be destroying your blood sugar control. Reading labels for fiber content, choosing foods in their whole, intact form, and eliminating foods made from flour, even whole wheat flour, can transform your blood sugar response. Now we come to the second proven strategy, and this one reverses damage thousands of seniors have already suffered. Strategy number 2 is eliminating inflammatory seed oils from your diet. Many people have never heard that seed oils affect blood sugar. They think oils only matter for heart health or weight. They use vegetable oil, canola oil, soybean oil, and corn oil freely. These oils are poisoning your metabolism. Seed oils are the most inflammatory substances in the modern diet. They are extracted using high heat and chemical solvents. They are refined, bleached, and deodorized. By the time they reach your kitchen, they are molecularly damaged. When you consume these oils, they incorporate into your cell membranes. They create oxidative stress. They trigger inflammatory cascades throughout your body. That inflammation directly damages your insulin signaling. Inflammatory molecules block insulin receptors. They prevent glucose from entering your cells. They force your pancreas to produce more and more insulin just to maintain normal blood sugar. Over time, this creates insulin resistance, the hallmark of type 2 diabetes. I saw this pattern in a 69-year-old patient named James. He was doing everything right with his carbohydrate intake. He ate vegetables, lean proteins, minimal grains, but he cooked everything in vegetable oil. He used margarine on his vegetables. He ate salad dressings made with soybean oil. His blood sugar was still climbing. His fasting insulin was dangerously high at 18. Normal is below 10. When we analyzed his diet, he was consuming more than 40 grams of seed oils every single day. We made a complete switch. We replaced all seed oils with extra virgin olive oil, avocado oil, coconut oil, and grass-fed butter. We eliminated all processed foods containing soybean oil, canola oil, or vegetable oil. We taught him to read ingredient labels obsessively. After 6 months, his fasting insulin dropped to 8. His fasting blood sugar fell from 118 to 96. His inflammation markers, measured by C-reactive protein, dropped from 4.2 to 1.1. The transformation happened without any other dietary changes, just eliminating seed oils. Another overlooked issue is restaurant food and packaged snacks. Almost everything in restaurants is cooked in seed oils. Almost every packaged snack contains soybean oil or canola oil. Even foods labeled healthy often contain these inflammatory oils. Whole grain crackers, protein bars, veggie chips, hummus, salad dressing, all poisoned with seed oils. For most seniors, the essential oil switches include replacing vegetable oil with extra virgin olive oil for cooking, using coconut oil or ghee for high-heat cooking, making homemade salad dressing with olive oil and vinegar, avoiding all margarine and using real butter instead, and reading every ingredient label for hidden seed oils. Research clearly shows that reducing omega-6 fatty acid intake from seed oils while increasing omega-3 intake from fish improves insulin sensitivity dramatically. Studies show that replacing just 5% of calories from seed oils with olive oil reduces diabetes risk by 15%. The exact impact depends on how much damage has already occurred. Finally, many seniors assume expensive oils do not matter. They think oil is oil. They buy the cheapest option. But the type of oil you use determines whether your cells become inflamed and insulin resistant or remain healthy and responsive. If you are using vegetable oil, canola oil, or soybean oil, you are poisoning your metabolism every single day. By this point, you may realize something important. Most seniors are not intentionally damaging their blood sugar. They are following outdated advice. They are trusting food labels. They are eating foods they believe are healthy. Each meal with ultra-processed carbs and seed oils pushes them closer to diabetes. Together, these poisons can cause diabetes even in people who avoid all sugar. Now, let me walk you through the third proven strategy for seniors. This is the approach I use with my own patients over 60. Strategy number 3 is understanding the glycemic impact of food combinations and meal timing. For most seniors, individual food choices matter. But how you combine foods matters even more. Your body responds very differently to a carbohydrate eaten alone versus that same carbohydrate eaten with protein and fat. Carbohydrates eaten alone cause rapid blood sugar spikes. Carbohydrates eaten with protein and fat cause slower, more moderate blood sugar rises. This is not a small difference. This is the difference between blood sugar control and blood sugar chaos. When you eat protein with carbohydrates, protein slows stomach emptying. This means glucose enters your bloodstream more gradually. When you eat fat with carbohydrates, fat further delays digestion and blunts the blood sugar spike. When you eat fiber with carbohydrates, fiber physically slows glucose absorption. This alone can dramatically reduce your peak blood sugar after meals. The appropriate combination strategy looks like this. Never eat carbohydrates alone. Always pair them with protein, fat, or both. If you eat fruit, pair it with nuts or cheese. If you eat rice, eat it with fatty fish and vegetables. If you eat potatoes, eat them with steak and butter. A common effective approach is eating protein and vegetables first at every meal, then eating any carbohydrates last. Some people need to eat protein 10 minutes before carbs initially, then allow both together as insulin sensitivity improves. Fourth, understanding meal timing. When you eat matters almost as much as what you eat. Eating large carbohydrate meals late at night when insulin sensitivity is lowest causes bigger blood sugar spikes. Eating carbohydrates early in the day when insulin sensitivity is highest causes smaller spikes. Fifth, the power of vinegar. Adding 1 tablespoon of vinegar to meals containing carbohydrates reduces blood sugar spikes by up to 30%. Apple cider vinegar and water before meals improves insulin sensitivity. This is not a replacement for proper food choices. Vinegar is a supplementary tool. You cannot drink vinegar and then eat donuts. I had a patient age 72 who followed this combined approach. She ate the same foods she had been eating, but she changed the order and combinations. She started every meal with a salad dressed with olive oil and vinegar. She ate her protein and vegetables before touching any starches. She never ate carbohydrates alone as snacks. Within 2 months, her average post-meal blood sugar dropped from 165 to 118. Her A1C fell from 6.8 to 5.9. She avoided diabetes without eliminating any specific foods, just by changing combinations and timing. At this point, it is important to understand one critical truth. Food combination and timing are powerful, but they are not magic. There are situations where even perfect meal timing will not overcome terrible food choices. One of the most common issues is portion size. If you eat massive portions of even well-combined foods, blood sugar will still spike. Another overlooked factor is stress and sleep. Chronic stress raises cortisol, which raises blood sugar independent of food. Poor sleep creates insulin resistance that no food combination can fully overcome. Medications are another silent contributor. Steroids, certain blood pressure medications, and even some antidepressants can raise blood sugar. If you are taking these medications, food strategies become even more important. There is also the issue of individual variability. Not everyone responds identically to the same foods. Some people spike dramatically from rice. Others handle rice well but spike from oats. Continuous glucose monitors can reveal your personal responses. This is why persistent high blood sugar despite dietary changes should always be evaluated thoroughly by a medical professional. Do not assume that one strategy will fix everything. Diabetes is complex. Multiple factors contribute. I want to share a quick example. A 70-year-old man came to me frustrated. He had eliminated all processed foods. He was using olive oil exclusively. He was combining foods properly. His blood sugar was still elevated. Further evaluation revealed undiagnosed sleep apnea. His oxygen levels dropped 40 times per hour during sleep. This was causing massive stress hormone release and insulin resistance. Once we treated his sleep apnea with a CPAP machine, his blood sugar normalized within 6 weeks. Now, let us continue with the fourth proven strategy. Strategy number 4 is increasing insulin sensitivity through strategic movement and muscle building. Many seniors think exercise is only about weight loss or heart health. They walk for 20 minutes and assume that is enough. Movement affects blood sugar more powerfully than almost any medication. When you move your muscles, they pull glucose out of your bloodstream without requiring insulin. This is critical. Muscle contraction bypasses insulin resistance entirely. After you eat a meal containing carbohydrates, your blood sugar rises. If you sit still, that glucose stays in your bloodstream until insulin slowly pushes it into cells. If you walk for 10 minutes after eating, your muscles grab that glucose immediately. Blood sugar drops rapidly. Insulin does not have to work as hard. Over time, this prevents insulin resistance from worsening. I saw this clearly with a 67-year-old patient named Linda. She had been walking 30 minutes every morning before breakfast. Her blood sugar was still climbing. We changed one thing. She started walking for 10 minutes after every meal instead of one long walk in the morning. Within 3 weeks, her average blood sugar dropped 22 points. Her post-meal spikes decreased from 180 to 140. She was moving the same total time, just different timing. The impact was dramatic. Many seniors make the mistake of only doing cardio. Walking is good, but resistance training builds muscle. More muscle means more glucose storage capacity. More muscle means better insulin sensitivity. More muscle means lower fasting blood sugar. The key principle is this. Movement immediately after meals lowers blood sugar spikes. Resistance training 2 to 3 times per week builds muscle that improves baseline insulin sensitivity. Even simple body weight exercises, resistance bands, or light weights make a profound difference. Do not wait for blood sugar to become severely elevated. Start moving strategically now. The earlier you start, the more damage you prevent.